Dr. Katie Garrett, and I'm here for this week's Root and Riddle Vet Check. With the Kentucky Derby coming up, we want to give you information on how imaging plays a big part in getting a horse to the races. We use a variety of types of imaging for horses, including radiographs, commonly known as X-rays, ultrasound, CT or CAT scans, and MRI. In fact, we use the same kinds of equipment to image horses that is used to image people. The goal of imaging any patient, be it a human or a horse, is to figure out exactly what is wrong so that we can treat it effectively. One big difference is that our patients can't tell us exactly what hurts, so sometimes we have to be a little bit more creative to figure out the diagnosis. Imaging can play a role in a horse's life from a very young age, even from before they are born. Ultrasound is used to determine when to breed a mare, to confirm pregnancy, and even to determine the sex of the fetus. Foals, newly born horses, can be susceptible to respiratory disease, so we use ultrasonography to check their lungs for signs of pneumonia. Young horses, such as yearlings, are screened using radiographs to check for developmental bone problems such as OCD or minor trauma. Most of these problems can be corrected using routine surgical procedures before the horse enters athletic training and they become a problem for the horse. Once a horse is in race training, they have started their careers as athletes. If they show any signs of soreness, we use imaging to investigate the source of the problem. We use ultrasound to examine tendons and ligaments for strains or tears, and radiographs to look at the bones for signs of injury. One of the advances in equine imaging over the last 15 years or so is the availability of digital radiograph and ultrasound equipment that is portable, so it can be taken right to the horse at the track or the farm. However, some problems require more advanced imaging that requires a trip to a hospital or a clinic. This includes MRI and CT scans, which provide more detailed information. MRI is often used to investigate tendon and ligament injuries, cartilage damage, and bone bruising. CT gives excellent detail about bones and is particularly useful if a fracture has occurred. For example, we can use the three-dimensional information to gain a better understanding of the fracture configuration and repair it. One of our goals is to be able to diagnose injury at an early stage so that we can institute treatment promptly and return the horse to health as soon as possible. As technology advances, we are able to better achieve this goal. For example, CT and MRI have been used to diagnose underlying problems early enough that horses have been able to be taken out of training before a catastrophic injury could occur. Thanks for tuning in to this week's Root and Riddle Vet Check, only on the Kenny Rice Horse Racing Show.